Dr. Whitney Hamed with the Wellness Connection, and I have been specializing in prenatal chiropractic care for 18 years now. I'm certified in the Webster Technique, which is a specific prenatal chiropractic technique since 2008, so I've been able to help hundreds of women with their lower back pain and what's called SI dysfunction, to help them really manage and get relief through a natural means or natural method through chiropractic care. There is a high percentage of women that suffer from lower back pain during their pregnancy. 3 major studies have been done, one starting in 2004 and 2 follow-ups in 2012 and 2019. And what I think is interesting is that all 3 studies showed an average of 68 to 70% of women suffer from lower back pain during their pregnancy. And on top of that, all 3 studies repeated that 1/3 of all those patients did not receive care for their lower back pain problems. Typically, chiropractic care, along with other types of healthcare services, are great options and alternatives for women who are suffering from joint-related type of pain through their pregnancy because of the restrictions on prescribed and even over-the-counter pain relievers. The whole goal of working with a woman throughout her pregnancy through chiropractic care is to restore the proper mechanics or proper function of the sacrum, the lumbar spine, and the SI joints. When that is achieved, then a woman can feel relief not only on her muscles, but her ligaments and her nerves. So it's a way to restore that proper function through a woman's pelvis, lower back, and SI joints. When a woman experiences pain, really when any of us experience pain, but especially through pregnancy, we have elevated stress hormones or cortisol. What studies have shown is that not only toxins, but different levels or high levels of stress hormones can cross the placenta and what we call sometimes prime that infant. So it could raise that susceptibility for that child later in life to have an increased or lower threshold to a stress response. So I see myself as a part of a healthcare team. I really value and think it's very important to collaborate and communicate with a woman's obstetrician, and maybe even with other services or healthcare providers, such as a physical therapist, acupuncturist, massage therapist, but primarily that doctor, so that we can be on the same page and understand what that woman's needs are and any other needs that she may have throughout the pregnancy. So yes, working in tandem or working as a part of a healthcare team, providing documentations and notes and communicating what I'm doing to help a woman with a woman's doctor and/or birth provider. What I find when a woman walks through my office, the first and most important thing is that I understand where she's coming from. I understand what has caused her pain, what she typically does in a day throughout her pregnancy, what aggravating factors she may have. So the first part of that health consultation is understanding the cause of her problem. From there, I like to then go into a deep explanation of what I find, which is misalignments of the lower back and pelvis, where those are occurring for her. Is there any ligament instability? Is there any muscular problems? Do we need to, again, collaborate with other health providers? Then what I explain to a woman in her pregnancy is that here's what treatment will look like. Typically, I see a woman in the beginning anywhere from 2 to 3 times a week, depending on the severity of her symptoms. And then, usually about the 4-week marker, 90% of my patients are improving, so we're able to reduce that frequency. And typically, I see a woman on an average of 1 time a week throughout her pregnancy to ensure that not only does she continue with pain relief, but we continue to keep the areas in balance and stabilize what we have worked on. I value working with women in my community and their birth providers and their doctors, so I invite you to reach out to me if you have any questions in and around the service that I provide, how I help women, or any education around that.